So during the course of the day, tipping over the 70% first dose mark, as we will, means that we can honour and indeed exceed the commitments that we had made to the Victorian community, particularly in metropolitan Melbourne just a couple of weeks ago. But I've got a list here which I will run through of the things that change from 11:59 p.m. tomorrow night. So firstly, there are 5 reasons to leave the home at the moment. There will, from midnight tomorrow night, be a 6th, and that is for outdoor social interaction. We know that this is what the community is craving, the notion of being able to see people that they love and care for, the notion of being able to visit with other people. That has to be done safely, and that's why the Chief Health Officer has recommended and Cabinet has endorsed that for this new category of outdoor social interaction, one person may meet with another person, not from their household, for a picnic or another outdoor activity, regardless of whether they are vaccinated. Those who are fully vaccinated can meet in a group of up to 5 adults, plus their dependents, from as many as 2 households. So if you're not vaccinated or you only have 1 dose, you can, as a group of 2, go outside and have that social interaction outdoors. If you're fully vaccinated, that number goes from 2 to 5, but it is a maximum of 2 households. So we will see from 11:59 p.m. tomorrow night, so into the weekend, we'll see groups of people outside enjoying each other's company in a safe way. The groups are larger if you're vaccinated fully because there's protection that comes from being fully vaccinated. If you're not vaccinated, by logic tells you, and the Chief Health Officer has confirmed, that group needs to be smaller. It needs to be just the 2 people. This is what Victorians have craved for a long time, and we're pleased to be able to take these modest but I think significant steps to provide this outdoor social interaction. It needs to be done safely, it needs to be done carefully, but these are important steps for us to take today. The time permitted will double from 2 hours to 4 hours for both exercise as well as the outdoor social interaction. And the distance you can travel from your home doubles from 5 kilometres to 10. So those 3 steps are in line with what we had spoken about being able to deliver. In fact, they're indeed beyond what we had indicated we would deliver a couple of weeks ago. We're not overselling it. They are modest changes, but they are significant, and I'm sure people will avail themselves of those options that have been not safe and have been denied to the community for many weeks now. Just to go through the rest of the announcements as they relate to both metropolitan Melbourne but also regional Victoria. 2 people will now be able to train outdoors with a personal trainer. Skate parks and outdoor communal exercise equipment will also reopen. Child minding for school-aged children, so that's in-home child minding. Some of those, I think they've been described many times as a grandparent type arrangement. That'll be extended. At the moment it's only for households where there are 2 authorised workers. It'll now be for households where it's just 1 authorised worker. Up to 5 people will be able to attend an entertainment venue or physical recreation facility for the purposes of broadcast of either a performance, a class or a concert. Real estate inspections will resume by appointment only. The property would need to be vacant at the time of the inspection. The agent will stay outside. The prospective tenants or those who are seeking to purchase the home, they will be able to move through the home and inspect it. The residents there can't be at home. It doesn't have to be a vacant property, but for the time that the inspection's going on, they need to vacate. They need to move out for that hour or however long it takes. Limited and with COVID-safe rules, I'm sure the real estate industry and all of those who either want to get into the market or are looking to sell or have new tenants move into their property will be very appreciative of those changes. And we'll have a conversation, as we always do, with that sector to make sure they fully understand what those rules mean. In terms of construction, we've had a lot to say because we've had to, on the basis of case numbers and the amount of infection that's been going on in our construction sector. What I can announce today is that construction workers statewide will need to show evidence to their employer that they have had at least a first dose of a coronavirus vaccine by 11:59 p.m. on the 23rd of September. So basically, construction workers have a week to get, if they've not already got a first dose, to go and get a first dose of any of the vaccines that are available, and they will need to demonstrate to their employer that they have done that. We've seen too many cases in construction, vaccination First dose helps, second dose is obviously better, but in order to strike that balance and have maximum protection, but at the same time keep that industry going and all of those jobs and livelihoods, trying to protect them as best we can, first dose by next Thursday is mandatory. That is required. No debates entered into. If you've got health reasons, fair enough, but people need to go and get vaccinated. And Jerome can speak to some of the priority treatment that we'll provide and some of the ways in which we'll try and facilitate that as quickly as possible. As I said, there will be some limited medical exemptions and things of that nature, but that industry needs to take this seriously and go and get vaccinated, go and get your first dose if you haven't already. Otherwise, you will not be permitted to work. That is not a choice that anyone should make. They should, in fact, put their safety and the safety of the community first and go and get their first dose. Now, on from that, and I know this will be, there'll be significant impact from this, but we've seen many seeding events and transmission events that relate to construction. Ballarat is essentially one of those examples. But from 11:59 p.m. Tomorrow night, construction workers will no longer be able to cross back and forth over the metropolitan regional boundary. That is a challenge, I know, but we're just seeing far too many events, and even people who have COVID safety at the front of their mind. If you're travelling back and forth from metropolitan Melbourne into the regions and back again, then the virus will hitch a ride. That's exactly what has happened, and we've seen not only what's happening in Ballarat, but we've seen it in a number of other regional communities. If we finish up with cases that are running wildly in regional communities, then we have no choice but to shut those communities down. There will be support for anybody who is adversely affected by this. I apologise that this is the only way forward. It's going to be disruptive for a number of people. There are income supports there for you. This is the advice, this is what we must do to try and limit the number of cases. I don't want to see a situation where there are more Ballarats, more Sheppartons. Albury, for instance, today the New South Wales government has had to have a lockdown there. We want to try and limit the impact on regional communities, and if we see all this construction movement, we will see more cases, and that will mean we have no choice but to lock down bigger and larger parts of regional Victoria. This is about safeguarding what regional Victorians have built. I apologise for the inconvenience, but this is the advice on what is safe. They're not easy decisions to make, but there's no alternative. There are a range of other issues around deliveries and who can come on site and who can't. We'll be working with the building sector, with the construction sector, so they fully understand all of those issues. Moving now to regional Victoria, who, as you know, we did some easing there not that long ago, so there's not, I don't think, a great expectation that we were going to take enormous further steps. But with the exception of Ballarat, because of course Ballarat is now operating under the same rules as Melbourne, but for the rest of regional Victoria, I can announce that again from 11:59 p.m. tomorrow night, again all on advice from the Chief Health Officer, gyms and outdoor and indoor pools can reopen. That excludes spas, saunas and steam rooms. They'll reopen with limits. All of those sectors are well aware and I think have operated in one form or another with rules, with COVID safe plans. It'll be no different. We'll communicate with them and there'll be wording up on the website so people have got absolute clarity. But it'll be things like density quotients, 1 person to 4 square metres. But it's safe to do that now given there are so few cases in regional Victoria, but we've got to keep it that way, which is why we're making other difficult but necessary decisions. Hydrotherapy and swimming lessons can occur. Again, there'll be limits and safety protocols. Tour buses can operate, again, with limits. You've got a list there in front of you. I'm not, again, overselling what this means for regional Victoria. They are small steps, but they are safe steps to take. That's the view of the Chief Health Officer, and it's on that basis that we have endorsed this opening up. If I can just go back to the top, we've got more cases today, but we have a very high test number. We have a very high vaccine number. We said we wanted to do 1 million vaccines, million jabs in 5 weeks. We beat that. We did that ahead of time. Thank you to every Victorian who's been part of that. We said that when we got to 70% first dose, we'd be able to do some modest but meaningful things. And that's exactly what we're announcing today. Doubling the distance you can go from your home, doubling the time you can spend out of your home, and also the notion of this outdoor social interaction, the thing that so many people have talked to me about, the thing they're craving most, seeing those they're closest to, getting out and about, being able to, in a safe way, engage with others beyond their household. Of course, you'd always like to do more, but we have more cases today than we've had for a very long time. We've got more people in hospital than we've had for a very long time. and we have to balance this out. We're not at 70% double dose, we're at 70% single dose, and there is a big difference with that. On Sunday, though, we'll be back to talk about what the rest of September, October and November looks like, and indeed beyond that. And it won't answer every question, and it won't necessarily provide every single rule change for months and months and months. It'll be a meaningful document, and it'll give people a really clear sense of what we're working towards. There'll be caveats, and there'll have to be, that's just the nature of this. It is uncertain. But these are really important steps. This is a good day because exactly what we said we wanted to work towards, we've been able to achieve. 70% first dose, 1 million jabs in 5 weeks. This is a credit to all Victorians. But those numbers are growing, and that's why these steps are safe. And to do more than this, particularly if you were to do substantially more than this, despite the fact that's what we want, all of us, that would not be safe, and that would not be endorsed by the Chief Health Officer and the public health experts. They are not the decisions to make at this time. They will just drive more cases, more people in hospital, and it'll make the job of our nurses even harder than it is right now. Talk about testing, particularly in Ballarat, and the addition, I think we've got 4 additional sites opening up today, as well as to speak to cases and some of the architecture of this outbreak. I'll now throw to the COVID commander, to Jerome, and then we'll take any questions you've got.